Good afternoon. I am Lil Nicoletti with Perioperative Consulting, LLC. Welcome to the Perioperative Perspective series. Our speaker today is Vangie Dennis. Vangie is a partner and consultant, along with Ruth Shoemaker and myself, Lil Nicoletti, with Perioperative Consulting. Our partnership with Advantage Support Services is supporting the Perioperative Perspective series. Vangie's professional organizations include AORN. She has been the past president of AORN and is an active member, along with the Association for Nursing Leadership, the Laser Institutes of America, many AORN specialty assemblies, and the American Society for Lasers in Medicine and Surgery. As a housekeeping point, any questions, please send to our LinkedIn page at Perioperative Consulting, LLC, and we will respond. We can also provide a PDF of the handout at your request. Without further ado, I present today's featured speaker, Vangie Dennis.
Thank you very much, Lil. It's an honor and a pleasure to represent my colleagues with Perioperative Consulting Services and to hope to give you information to understand what a 360 assessment is, because it's so customized to the needs of the organization when you're looking at what efficiencies are. So what is a 360 assessment? It can be a multitude of things. A 360 assessment is important for hospitals because it provides a comprehensive view of the employee's performance by gathering feedback from multiple sources such as your colleagues, your supervisors, your subordinates. And this in turn helps to identify areas for improvement, enhance leadership development, teamwork, and ultimately contribute to better patient care by ensuring all the staff are performing at their best across various aspects of their roles. So what are the key benefits of a 360 assessment? Increased awareness, self-awareness, because employees then gain a holistic understanding of how they're perceived by others, as well as highlighting both strengths and weaknesses in order to focus and improve personal development. It improves their work relationships. And by understanding how their actions impact colleagues, employees can work towards building stronger and more collaborative relationships. It also enhances leadership development because leaders can identify areas where their leadership skills need improvement based on feedback from their team that normally they wouldn't come and talk to you about. You're targeting training opportunities, and that is used to define specific programs to identify your gaps, your skill gaps. Better communication, openness, and honest feedback provided with the teams lead to improved collaboration, and by improving individual team performances through development opportunities, a 360 assessment can ultimately lead to better patient outcomes. So why is a 360 evaluation important? Well, it provides a well-balanced view of the behavior and the skills of the employee. It also helps employees to know themselves from others' perspective, as well as bridge the gap between what they think of themselves and what others think of them. This feedback system is constructive and more acceptable for employees. It's easy for them to relate, to open up. Employees feel like they're part of the solution, improving the processes. And who are these individuals? They could be ancillary staff. They could be your peers. Need to talk to your patients. Pay for performance. The employee's perception of their own personal competencies. Your managers, your direct reports, your customers, and can include other colleagues. What can a 360 do? It could help you maximize operational efficiency, productivity, and this in turn results in increasing revenue and better quality of patient care. A lot of times, 360s should be customized to the needs of the organization or the system. That includes the operations, the strategic plans, the educational programs, and the technology and research. The advantages of a 360 are it gives you a fuller picture of the employees and performance, as I said earlier. And it's easier to spot developmental opportunities in terms of teams or departments. A 360-degree feedback, also known as a multi-source or multi-rater assessment, is a way for individuals to understand their personal strengths and weaknesses using a positive, constructive feedback of others who work with them the most. It also offers a more balanced view by capturing how the employee is perceived across various roles. Managers can assess leadership abilities. Peers provide feedback on collaboration and teamwork. Subordinates evaluate leadership styles, and clients may provide insight on external facing skills. So experts can offer a broad base of healthcare provider services because we go to so many different places. And this has to in turn meet the changing industry and challenges. You've heard the cliche, if you're not changing, you're dead. And change, I just posted something on LinkedIn, how important it is to embrace change. It helps navigate the road to growth with measurable milestones. Characteristics of a 360-degree feedback has to be user-friendly and intuitive. It must be anonymous and secure, as well as flexible and personalized with a comprehensive competency framework, informative in action delivery reports. We have to have action items on the reports, robust security measure, and you just don't stop after the report's giving a follow-up with ongoing support and guidance. I listed all the opportunities that you can investigate by doing a gap analysis and an initial assessment of your organization, whether it's block scheduling or business requirements, or what are you doing as far as CMS key performance indicators or quality indicators, financial performance, surgical scheduling. I'm not going to read all these, but again, it needs to be user-friendly and intuitive. And this tool can be used by numerous stakeholders inside and sometimes even outside the organization. We said they have to be secure and anonymous. Software should provide a built-in anonymous feature, flexible and personalized to the institution, and check to see what degree the tool offers customization. It also should provide feedback to all employees of the organization. Every employee is measured on competencies that are specific to their roles. And 360 feedback tool can help you select for your organization and provide the employees with a detailed report. The report should collect and tabulate information received from all the people involved in the process. Needs to be robust security measures, that's important, and ongoing support and guidance, as I said earlier. Talked about key performance indicators. Improving efficiency in peri-op services and assessing relevant metrics is crucial for not only quality, but optimizing your resources and improving patient outcomes. When we have downtime and we're not maximizing our structure with a structured approach to how we operationalize perioperative services, it becomes very costly. And it also can set up and create complications in your service line. 360-degree feedback acts as a catalyst for development by helping participants identify their strengths as well as their opportunities for improvement. The main advantage is it expands the scope of performance feedback an employee receives, giving a fuller and more balanced perspective. It can be a powerful resource because it helps leaders align themselves with requisite competencies for success, continuous learning, authentic team playing, and personal awareness. Seeing themselves as others see them, leaders spot ways of improving productivity. I think we all know what the preoperative preparation is, but it's important to streamline these protocols. An early identification of issues, whether it's in the patient's records or last-minute medical needs, avoids delays. That is what we call the day of surgery cancellations, because it can back your surgery schedule up. And what is the cost of a minute in peri-op services? Actually, surgery can run, depending on your location in the United States, $37 to $57 a minute. That's downtime where we're not utilizing resources. So a preoperative assessment, we know what preoperative is, a clinical evaluation, and it includes a medical history, recent test results, physical examinations, laboratory tests, other tests associated with the comorbidities of that patient, the patient interview, And along with the patient interview, we do as circulating nurses, cognitive assessment. By not providing a thorough assessment, we can delay or cancel surgical cases, which impact not only the patient experience, but efficiencies, and as I said earlier, can become very, very costly. Operating room utilization. Well, there's really two aspects you've got to look at. It's efficient scheduling, and you need to get schedulers that don't put us in a little cookbook recipe and do it the same way every time, because things change, characteristics of surgery change, and what may be an average operative time, you now can squeeze that extra case in because that surgeon and that team maybe has become more efficient. It is a reduction of turnover time between surgeries. And I like to brag because my turnover time was 20 minutes on average. And I'm not going to tell you an open heart's turnover time was no more than 20 minutes because we know it is. That was the average turnover time. And there's things that you can do internally by hiring a turnover team very inexpensively to help with putting on additional cases because you're moving the schedule a little quicker. Standardized workflow, and this enhances coordination among our surgeons, our anesthesiologists, and our ancillary services. So we know what block utilization is. It measures how many hours of surgery a surgeon performs against the number of block hours assigned. But what about that surgeon that's in his block time that goes and helps another surgeon in their block time? They're not getting counted for that. So you have to be able to comprehend what are you measuring when you're talking about block utilization. And primary hour utilization measures the total time used during the week, including block time or surgical time. And factors that impact operating room efficiency are, what about your personnel available? It used to be 2.5 FTEs were allocated for a pretty robust perioperative service line per room, per run of that case for the day. Today it's 3 because you got so much technology. You put 2.5 in there, you're not going to be able to turn over as fast. That's a fact. How about scheduling, as we talked to earlier? Do they have the autonomy to be able to move and shift as change occurs? Or under standardized operated workflow, we set our turnover time, $37 to $57 a minute. Pre and post operative factors such as patient's tardy. Do you have somebody that's running that board that can say, all right, let's move that patient and bring the other patients in? To improve operating room utilization, you can have conversations with your surgeons who are below 40% utilization. The target naturally is 75%. About how do they release their block time and ensure everybody's informed about high-level performance. So what is this, room utilization or block utilization? I am no way a black belt in lean processes, but lean process and waste reduction are important in assessment too. A lean process refers to a business methodology that focuses on maximizing customer value and systematically identifying and eliminating waste in all aspects of that production process. So, looking at it, what impacts it is identification reduction of non-essential steps, resource optimization. What about staff coordination and training and continuous training on standardized protocol and process improvement? I have an acronym they call the 8 WASTE. And the lean methodology identifies 8 categories of waste. And this acronym is T for transportation, unnecessary movement of materials, I for inventory excess, M for motion, unnecessary employee movement, W for waiting, delays in the production process, O, overproduction, too much, making more than what we need, having more on the shelf, it expires, and D, defects, errors that require rework or redoing on that. Continuous training on standardized protocols improve process improvement. The primary goal of lean is to identify and focus on activities that truly add value to the customer while yet eliminating everything else that doesn't contribute to the final service. Clinical assessment is a systematic process that involves collecting and analyzing information about patients with diagnosis and our treatment planning. What should be included in a clinical assessment? Well, number one, it can identify potential risk factors that optimize our patient conditions and aids in appropriate care. Why is it important? A thorough clinical assessment identifies issues precisely to allow high quality care, care that is safe, effective, efficient, timely, equitable, and person centered. High quality care is a principal route to reducing adverse events, including those that lead to hospitalization. A clinical assessment should typically include your interview process, a fundamental tool, observation or direct observation of patient symptoms and concerns, the test and checklist, and report historical documents or information from sources that can be integrated into the assessment. It's reliability, utilizing an assessment tool for consistent measurement, validity, measures what it claims, and standardization using norms, procedures, and clearly laid out rules to ensure the objective results and outcomes of the care. Medical history review. We know it's the chronic conditions of the patient and the surgical history and the allergies and the medication and the social history. That's all important. But understanding a patient's history helps to identify disease risk factors. Doctors recommend regular screening tests, lifestyle changes, or preventative medications. Or are they on medications prior to a surgical procedure that can result in more complications? Hospitals and other health systems utilize medical records to review and identify instances that could possibly harm our patients, ensure quality improvement, and enhance patient safety. An accurate review of relevant medical records is important also for medical claims management. A physical assessment includes all the systems of the body. And I think that is something that we see our anesthesiologists do prior to surgery. Physical exams are important because they can help you maintain good health for our patient, detect health issues early, and prevent serious conditions. Physical exams can also identify underlying conditions like heart disease and diabetes. If you do this in the pre-assessment phase, that's why I'm really big on pre-assessment to avoid same-day cancellation. You can pick all this up ahead of time and have prophylactic care if the patient really needs to have this surgery completed. It can prevent serious conditions. An updated medical history, as we know, is part of what we do as perioperative professionals, is an opportunity to reassess or detect hereditary problems and other physical problems. A detailed physical history and evaluation can deter cancellations and delays. Optimization occurs when you utilize nurse practitioners and have them assist in streamlining this process. We know there's a sequence of laboratory and diagnostic testing that should be done for specific procedures. But I think it's important to have a pathway for a lot of that. So unnecessary testing and laboratory tests are not done on our patients. Lab testing is the premier tool in a doctor's toolkit, and it helps them to identify, prevent, and treat sickness and disease. This is why it's important to us as a system, the patient, to understand what it is, who is performing it, and why you should want to perform it. So risk assessment and stratification. We all know there's ASA classes for patients. And being an executive director over 10 ambulatory centers that I had at one time, it wasn't a cookbook recipe that everybody who goes into ambulatory was a class 1 or a class 2. We have to look at other things such as risk of complications. Why would you put a cataract patient, who in a lot of times can be a class 3 patient, into the hospital setting to do the cataract without a complex risk assessment tool that allows them to go back into the ambulatory setting? And that's called a virility assessment, which is done on elderly patients. So key points about risk assessment and stratification. Risk assessment involves a comprehensive evaluation of factors that can lead to negative outcomes. It's steps like identifying hazards, analyzing the probability of occurrence, and determining the severity of potential consequences. They can be qualitative or quantitative using data and statistical analysis. Again, we're not all a cookbook recipe when determining that risk assessment and stratification. Risk stratification takes the results of the risk assessment, or the groups or individuals or population, based on their risk level, low, medium, and high. This allows healthcare providers to allocate resources and intervention more efficiently, focusing on those greater risks. Often utilizes what we call scoring systems or algorithms. I did that when we were over interventional radiology, and this helps assign risk levels based on relevant factors. Risk stratification enables providers to identify the right level of care and services for very distinct subgroups of patients. It's a process of assigning a risk status to patients, then using this information to direct care and improve overall health outcomes. In conclusion, a 360 review typically consists of a multitude of people, managers, staff, receiving and analyzing feedback to look at notable patterns in behavior and positive and negative feedback to create a report. And this can provide our employees with constructive criticism without overwhelming them. It's an assessment that is a performance management tool intended for employees to get multi-source feedback about work performance and improvement areas. In a 360-degree evaluation, the person being reviewed receives feedback from people whom he or she works with. A feedback model is the process by which an individual receives the feedback from a large or various population of stakeholders. 360-degree feedback gives valuable input from a multiple directions about what they're like to work with, instead of being limited to the perception of bias from a direct supervisor. The whole gamut receives a broader and more balanced viewpoint when engaging our team to give more or better quality outcomes for our patients and our providers as well as our employees. So I want to thank everybody for the Perioperative Perspective. Please follow us at Periop Consulting, LLC, and Advantage Support Services. Thank you so much for your time today.